on ventilators. Missouri hospitals currently have 1,947 ventilators available, with 115 in use. And this is good news. This is good news. Our hospitals are not overwhelmed. Missouri's positivity rate continues to decline. People are recovering, and we are moving forward. Earlier today, I joined hundreds of citizens and business leaders from the Good Morning Springfield Town Hall hosted by the Springfield Area Chamber of Commerce to talk about an update on the COVID-19 efforts that the state are doing, and also of the economy, of reopening the economy, how we could all move together, things we could do to really move our state forward. And I also traveled to Southeast Missouri today. Matter of fact, when I was in Southeast Missouri was the area when I first got the call of COVID-19 to come back to the state, come back to this area, to the back of the governor's office on March the 7th. So it was good to return back there today. We went and visited a couple of businesses down there. Plaza Tire Service was one of the places we stopped, locally owned business there. A lot of people in the shop today, a lot of people out. It was good to talk to the customers. It was good to talk to the business owners. And really pretty impressive to go down there and see what they had done in a tire shop arena, in a private business, because everybody's still got to be out there. That's an essential business. We still got to buy tires. We still got to get cars worked on. And for some of the things that they did there to protect their customers and protect their employees. Again, it's just what people are doing on their own to make it a little better. Also, because of National Police Week, I had the opportunity to stop down to Cape Girardeau Police Station down there to meet some of the members down there to thank them for their efforts during the COVID-19. Also with the Cape Girardeau County Sheriff down there, I got a chance to talk to her and the members of her department. Again, just thanking them for what they do every day, and really the same problems that they face by having people incarcerated, trying to protect the people within the jails along with protecting the public, and the situation they were first in when none of us had enough PPE gear. But again, that they kept it a priority to go out and answer the calls every day. And I want to personally thank those law enforcement officers for what they do every day, but especially during this time also of the COVID-19. COVID-19 has changed our lives in many ways, from our day-to-day activities to how we do business and everything in between. COVID-19 especially changed this year's legislative session. This session started with a lot of hope. As you all remember, in January, we were looking at one of the strongest economies we'd ever seen. And then all of a sudden, we know where we're at today and the things that we've had to deal with. We started out hopeful to capitalize on last year's successes and continue to build on our two main priorities: workforce development and infrastructure. We were also optimistic about addressing the violent crime plaguing communities across the state. We were optimistic about Wayfair. It was also a priority that we hoped the legislation would consider this session. And while some of these issues does not seem to be passing this year, this office will celebrate some victories this session. I also want to admit, most of you's been here, we know the last couple of days of the legislative session, nobody really knows what's going to happen, what bills are going to get across the finish line, what's not. There's still a lot of things out there that would be good for Missouri. I hope the legislatures will work hard to make sure they get those things completed that will really help us moving forward. Again, I think it's always so important to remember what our two priorities were in the first place: workforce development, infrastructure. Those are the two things that will bring our economy back. So anything we can do to help to strengthen that, I think is a good thing. The one bill that I asked both the House and the Senate to consider early in session was priority of the governor's office, was license reciprocity for military spouses. This bill was passed overwhelmingly by both the House and the Senate and will give our military spouses the ability to obtain an occupational license in Missouri that they received in another state. House Bill 1511 and other professional registration license reform legislation have put Missouri ahead of the pack. No other state has enacted the reforms that Missouri has on professional license reform. I truly believe this will be a leader in the nation and that many other states will follow what's happened here in Missouri when it comes to the reciprocity. The legislation passed this session puts us ahead of the country on license reform and builds on our successful workforce development agenda. Other priorities that have gotten done: priorities like tort reform, broadband, were also achieved. Tort reform on punitive damage, and still more work to be done in that area. Our broadband bill will help our COVID-19 response and the future of education and health care as they may shift to more virtual teaching and care. House Bill 2015 Appropriations Bill. Down to the final few hours, legislators are still working on important issues impacted by COVID-19, including changes to the absentee voting process. As I said in a briefing last week, Missouri must be prepared at all times to respond to any type of disaster that may strike this state. On March the 7th of this year, COVID-19 really started to have an impact on the state. Just a year ago, on March the 11th, some of the worst floods we've ever had in our state's history started. I said we will commit all the necessary resources to recover from COVID-19, but would never let down our guard from the other threats. The severe thunderstorms that swept across Missouri on May the 3rd and May the 4th left a trail of destruction so extensive that we have now begun the process to require and seek a federal disaster declaration. Our Missouri communities are already strapped by emergency response costs because of COVID-19. The additional federal assistance that would come with a federal disaster declaration would provide much needed support to affect communities and our electric co-ops. Late yesterday afternoon, we requested that FEMA participate in joint damage assessment in 19 counties in anticipation of a request for a federal disaster declaration for federal public assistance to help cover the expenses of emergency protective actions and damage to public infrastructure, including excessive damage to the co-ops, distribution lines throughout the state. And today, Director Karsten is here to give you an update on that. And again, I just want to emphasize how proud I am of what Director Karsten, her team has done to be the head of public safety, to be the public safety that's demanding enough each day, but to be handling the COVID-19 situation and also to be handling this natural disaster that our states are facing. So, Director.
Thank you, Governor, and good afternoon, everyone. As the Governor said, the severe storms that swept across Missouri on May 3rd and 4th left extensive damage and one death in Bates County. They produced winds in excess of 80 miles per hour in some locations, hail the size of tennis and baseballs, and the National Weather Service has now confirmed the storms resulted in 2 tornadoes, an EF1, which has winds of 86 to 110 miles an hour in Marston, which is in New Madrid County on May the 3rd, and an EF0, which has winds of 65 to 85 miles per hour in southwest Carter County on May the 4th. There also were strong winds in Dunklin County on May the 4th that actually derailed 25 rail cars. And there was more than 37,000 customers left without power. These power outages were not simply the result of smaller lines going down. The electric cooperatives sustained extensive damage to their major distribution lines throughout the affected areas. Because of all the damage to the public infrastructure, Governor Parson requested and FEMA has agreed to participate in joint preliminary damage assessments in 19 counties, which includes Bates County, Butler, Carter, Dallas, Douglas, Dunklin, Henry, Hickory, Howell, Laclede, New Madrid, Oregon, Pemiscot, Polk, Ripley, Shannon, Stoddard, Wayne, and Wright counties. Now, because of COVID-19, the preliminary damage assessments will not take place in the normal way. Usually, a local representative, a representative from the State Emergency Management Agency, and a representative from FEMA travel together, document, and agree on the damage that they see present. We are modifying the process out of necessity due to COVID-19. Instead of operating jointly and in person, the teams will operate virtually to review the images and detailed descriptions of damage to the public infrastructure and the electric co-ops, and they will reach an agreement on estimated repair costs. That process is underway today. According to FEMA regulations, we'll have until the beginning of June to complete the process. Once the assessments are finalized, the information will be reviewed by SEMA and the governor's office. And at that time, Governor Parson could formally request a disaster declaration from President Trump. As the governor has said, the state, our local partners, and our individual citizens must be ready at all times to respond to disasters and emergencies. And the fact that we're dealing with one type of disaster doesn't mean we won't be impacted by another one. Such was the case with flooding and tornadoes last May. Currently, the Missouri forecast calls for multiple rounds of thunderstorms and heavy rains with flash flooding possible throughout Saturday. Always pay attention to the forecast in your area, and always make sure you have several different ways of receiving weather alerts. And we ask that you stay safe and healthy. Thank you.
All right, Sandy, thank you so much. Thank you for what your agency does and for all the hard work of the people out there. You know, during the COVID-19, it got all of our attention. Basically every day, you was almost all consumed with that. But the reality of it is those disasters happen out there, and we had to be prepared for that every day. And I'm thankful for the work SEMA did. When that train derailed, we had people down there within the hours of that occurred, and we never missed a beat. It was a good thing we had the National Guard ready, that we did those declarations early on, although COVID-19 was the main emphasis of that. But again, we were prepared in this state. And I'm thankful for these agencies and the people that go out there every day and the local agencies for what they've done. To kind of wrap things up, there will be no briefing tomorrow. We will actually be traveling to Kansas City to visit the Ford Assembly Plant in Claycomo. I just want to give them a thanks for making some masks and some shields for us early on. They did that in their process up there. I got to talk to some of the Ford Motor Company executives, and they offered their assistance. But the good news about tomorrow, they're getting ready to go back into operations. So we're looking forward to making that stop, getting people back to work, and start making vehicles again here in this state. So over the weekend, I want to remind Missourians to continue social distancing. Missourians everywhere have stepped up to help one another, and it is because of your efforts that we are on the road to recovery. I continue to remind and encourage by how strong Missourians are together. Together we will get through this. Together we are Show Me Strong. Be safe, be smart, and practice social distancing. Thank you, and God bless. Kelly? Dr. Williams is also here today. He's got some pretty good news I think he wants to share with you today, so we'll get him up there to answer a few questions. So however you want to start off, Kelly.
Hi, Director. With this experience of the pandemic, has that at all changed the state's emergency operations in dealing with other disasters? I mean, I know there have always been plans out there, but has this experience changed how you're preparing for other events?
Well, it has, and I just spoke about one of those changes, and that is how the damage estimates are done. We're doing those virtually, and we have other changes as well, and it certainly impacts our thinking on how best to approach things. Definitely. Any other questions for Director Carson? Thank you.
Hang on, Doc. Hey, let me add one thing to what the Director Carson said there. Sometimes as governor, we go through all these training processes that you see at multiple agencies training together for multiple disasters and everything. And I'll be honest with you, sometimes you sit back there and you think, okay, how much training can you possibly do? Is that really going to happen or not? I'm thankful every day now that Missouri did all that training and was prepared when these events did occur and multiple ones happened at the same time. It does pay off to be prepared. So with that, Dr. Williams?
Thank you, Governor. And speaking of, the training and working together, reached a tremendous milestone as somebody who practiced at the bedside for 30 years and know what it's like to have a patient who needs something, whether it be blood or something. I can't thank the Governor and Sandy enough. On Monday, we immediately sent out to 18 hospitals throughout Missouri in 8 regions, so it's the entire state, Remdesivir, which is literally a life-saving drug for those patients. And remarkably, right now in Missouri, we have about 129 patients on ventilators with COVID-19 throughout the state. And tomorrow or Saturday, we get another 1,800 vials of Remdesivir. And that is enough to treat every patient in Missouri on a ventilator, which just is such a blessing that, first, that we have that few patients on ventilators now, and second, that we now have a medication that we will treat everybody this weekend who needs it. And so it's just a great credit to our hospitals who've been taking care of patients and getting them off ventilators. It's a great credit to our health departments so that we don't have new cases for people who end up on ventilators. And we greatly appreciate the federal government, our partners, getting us this drug. So incredibly appreciative of that, and happy to answer any questions.
So just going off of that, how is that Remdesivir being distributed, and what areas are being prioritized for the vials?
This is the amazing thing. We don't have to prioritize. Everybody's going to get it, which is just an amazing thing to say. But I just got off the phone with the Missouri Hospital Association. They put out a query who needed it, and we will have enough to give it to everybody.
Director, you said 1,800, another 1,800 vials. Is that the total number, or is that another shipment?
That's another shipment, Crystal, of 1,800, and we either use 6 vials or 11 vials for the severity of the patient. And so at about 129, that'll be enough to treat everybody, which is just wonderful news.
So has Missouri gotten a previous shipment of
on Monday we got, I think, 389 that we shipped out, and that's why I was so appreciative to Director Karsten and the governor. We had Highway Patrol. We got it at 10:30. We had Highway Patrol waiting in their cars, and they started driving all over from Missouri, all the way from St. Joe's to Kansas City to Cape Girardeau. It was all regions, and they will do that either tomorrow at about 11 o'clock or Saturday. If it comes in tomorrow, we're ready to go. If it comes in Saturday, they'll be ready to go, and can't just, again, having been on the other side of it, waiting for it to come, and I know the families will be waiting for it to come, can't thank them enough for getting it there quickly.
Hi, Dr. Williams.
Yes.
I know yesterday we kind of talked about ramping up the boxing in strategy.
Yeah.
So is DHSS currently boxing in any possible outbreaks at any assisted living facilities right now?
Yeah, we are trying to get to that capacity. We've done some, but we've had about 160. We had 3 new ones, I believe, either today or yesterday. So we are moving as fast as we can to implement that for those 3. Before I drove over here, that's what we were looking at. I was on the phone with Adam, and he thinks that we've got that in place for those 3 going forward. But if not by tomorrow, certainly by Monday, I hope that what we talked about with you earlier will be in place in Missouri for those long-term care facilities.
And I had a follow-up, sorry. And then how is DHSS able to do routine nursing home inspections, or are you able to during this pandemic?
Yeah, CMS put a moratorium on those during the pandemic, and that's allowed us to free up staff to do like our 24-hour hotline and some other things. And I'm not sure when that will be relaxed. So to answer your question, at this moment, no, but we will get into that as quick as we can. That'll come from federal guidelines.
Do you know yet medically what you need to see on the ground to let nursing homes open back up again to visitors?
I don't. It's a good question. I think that's something we'll continue to watch. The governor's talked about it in the past. I mean, we have, like my mother, we have people who haven't seen their families in, 8 weeks, 7 weeks, so we're incredibly sensitive to that. But on the other hand, a lot of that guidance also comes from CMS, from our federal partners. So we'll kind of wait to see what they say. It's obviously going to be, I think, not generic, because obviously New Jersey's in a very different, and New York are in a very different place than Missouri. But it's a good question. At this point, don't have a date or a threshold that would make us do that. But it's a good question. Thank you.
I know you did some testing in Sullivan County at the Smithfield plant there this week, and there's community testing in Buchanan County over the weekend.
Yes.
Do you think that there needs to be regular testing at these hotspots to really operate safely in these plants?
Yeah, I was on the phone with Triumph this morning very early at 7 o'clock about that. They've been incredibly, to me, conscientious, and so they called me this morning at 7 and said, okay, now where we are, what do we do going forward? And so that's very much part of our comprehensive testing strategy that we discussed earlier this week, and one of those is surveillance of hotspots, nursing homes, prisons, jails, meatpacking plants. And what will that look like? What I told Triumph this morning is what I anticipate we'll do is go work with them in about June and do some more PCR volunteer testing. We won't test everybody like we did last time, but we will probably do a sampling. And then that brings up the whole question of antibodies, and I talked to Triumph about that this morning. It takes 3 weeks to develop antibodies. We just checked everybody, so it doesn't really make sense to do antibody testing up there too soon, but there may be a role for that in August. But as I told Triumph this morning, I suspect by the time we get to June and want to do that, we may have some national guidelines about what it looks like this summer to go in and do exactly what you're talking about, which is what we call sentinel testing of prisons, jails, meatpacking plants, and long-term care facilities. And that will probably involve PCR and antibody testing.
Somewhat related, the health department in St. Joe, I talked to them earlier, and they said that they appreciated the support that they got from the state, specifically for contact tracing, because the state provided a Spanish language speaker, and they didn't have any on staff. Is that something the state can provide, specifically language services, or are there other resources for that when it comes to contact tracing through a language barrier?
Yeah, it's an interesting question, because one of the things we ran into was we sent some people up there from Jeff City and some surrounding areas, but we also found that it was best for some of our people to stay here in Jeff City because they have access to multiple languages through translators here. And so that was kind of a lesson learned going forward. Some counties will want to do their contact tracing themselves, and we will support that. Some will want us to send boots on the ground. But in that case, what was very interesting is that we found that we needed to keep some people back because here in Jeff City, we have access to multiple translators that we can deploy in all 114 counties from Jeff City. Thank you, Dr. Williams. Thank you.
Hi, Governor.
Kurt.
You've been pretty adamant against mail-in voting, but there is a bill that's, or an amendment that's running through the chambers right now, and I've been told that you helped craft it, or your team did. What's changed in your attitude towards that?
I didn't craft it, I can tell you that, personally, but I'm not sure who all was behind that. But the thing of it is, I think we got to look at what the possibilities are, the reality of what this might look like come August or November for voting. And say, I think there's different things in there as long as we can verify, whether it's a mail-in, whether it can still notaries, things like this come into play. I'm not for sure what all that language is or what it'll look like when it gets here, but I think we're open to taking a look at to see what that is.
And then one more. You were in Senator Sifton's office not too long ago this afternoon. What kinds of things are you trying to work out with him?
Now, how do you know that, Kurt? We didn't put out no press release about that visit or anything.
I just know.
Okay, all right. Let me first start off. I went down there, his job as a governor, sometimes there's things in the legislative session at the end that you get interested in. You're always a little afraid to let anybody know you're interested in when you're governor. But what I really went down there to talk to a couple of the legislators, a couple of senators about, there was a bill down there, it's a crime bill, and it has to do with witness protection. And it was a priority for the inner cities, for the African-American communities. Basically, a lot of them, that was something that they really wanted. And I wanted to do everything I can to make sure everybody realized, in the end of the session, a lot of things happen here where, and I've been in the legislative body, so I know how that goes. Somebody gets mad at somebody, or somebody holds up language and all this kind of stuff that goes at the last. But this is something that really does have an impact on everyday people. We got to try to figure out how we deal with violent crime. I know COVID-19 has been on the front page, but as we just seen here recently in Kansas City and St. Louis, that violent crime's out there. This was a tool for that. I wanted to stress to the senators and the people that, I think this is a great opportunity. We can help people when it comes to testifying in violent cases is what it was. So that's what I went down there and talked about. I'm not sure the end of the game. There was no arm twisting. It was just a matter of saying, hey, I think this is really important for the inner cities in our state to get that done.
Just given how businesses and the public are being asked to adapt right now, if the legislature does come back for a special session, would you personally hope that they treat social distancing more like they did with the supplemental budget rather than what we've seen in the past couple weeks?
Now, repeat that again on that.
Just given how businesses are being asked to adapt right now, if the legislature does return for a special session, would you hope that they social distance more than they have in the past couple weeks?
Well, I think, again, the legislatures, have a job to do, so they are somewhat in an area like where their chambers are. It's up to them to how they conduct the legislative session. So, I mean, those are choices they got to make. They got to make how to do the social distancing. Social distancing is in effect for everybody, in the state. But again, it's a little different circumstances when you got 163 members in the chamber. There's different ways you could do that, I guess, that I would think of as being a former legislator. But the reality of it is that's up to them to decide how they're going to conduct that. I hope if they come back for a special session, I hope we know a lot more. And I think it's a lot more safer to be in here than it is today, as we move forward. So I hope we take advantage of, look, I still think the social distancing, whether you wear a mask, whether you don't, comes down to common sense, what people's responsibilities are. And the legislature will be in the same boat. They got to make those decisions.
Governor, health experts are predicting that COVID-19 will last throughout the year, and that, just the other day we talked about the vaccine coming maybe at the end of the year, and that Pfizer's working on it as well. So any mail-in ballot system that the legislature would pass, would you want it to also cover the August and November elections?
Yeah, we'll just have to look at that and see what comes through when it comes to the legislative branch on that and see where we're at. Look, we know the virus is going to be around, but we don't know what the effect of the virus is going to be in July, let alone August or November. But look, we're not going to overhaul our voting system because of coronavirus. I mean, I'm not for that. So if you're going to what the National Democrat side of it are really wanting, we're not going to go down. That's a political issue, and we all know that. I mean, the ones that are inside, we understand what that is. So, look, the only thing I'd be looking at anything is somebody's safe to do that. But right now, people are out and about in the state of Missouri, going lots of different places. Everywhere you want to go, you see people out. So, I think we can figure out a way to make it safe for voting.
On the no excuse absentee for COVID topic, I was talking with Senator Wieland, who's handling the bill with that language, and he expressed a lot of doubts that it's going to be able to make it through. So he actually suggested it may make more sense to have a special session on that topic in conjunction with whatever budgetary special session you called. Would that be something you would be amenable to?
Yeah, Jason, let me just say this on special session. Everybody's come up to me and said, would I have a special session for tort reform? Would I have it for voting? Would I have it for this? Would I have it for the budget? I mean, just multiple people are asking that all the time. Look, we don't know. I don't know what I'm going to call in for a special session. The main thing I want to do right now is handle the COVID-19 virus, see where that's going to be come July, or the 1st of June, and how we're going to get the economy going. That's my two priorities right now for the state of Missouri. And all those other things we'll just have to address as we go forward. I don't know when I would call a special session, and it just depends on a lot of things. But those would be some of my priorities to look about calling a special session.
And one other question about something that didn't pass this year. It's very unlikely the legislature is going to make any changes to the low-income housing tax credit program this year. I think that there is a nexus between that issue and coronavirus because a lot of people are losing their jobs and may need more housing eventually, even though I understand housing takes a while to actually be cultivated. It's been 2 years now. Is it about time that you're going to instruct your appointees on MHDC to restart that program soon?
Let me just say this. I will have everything on the table I possibly can have to get the economy started up again. And that will be part of that conversation when the day comes. But look, we got to make sure we're getting jobs back there. We got to get construction jobs back out there. We got to put people in the workforce. We got to expand. And whatever it takes to do that in Missouri with what I can within the means I have as governor, I'm going to do. and make sure I'm responsible about doing that.
So that's a maybe, basically, or a yes.
What's that?
Was the answer to my question yes or maybe?
The answer to your question is I'm going to have everything on the table and decide how I move forward, was the answer to your question.
Thank you.
But good try.
Kind of a two-part question here, Governor. There are some state senators who are maybe potentially holding up the prescription drug monitoring program in the Senate, saying that House Bill 1450 has to pass first. What are your thoughts on that?
You know what? The Senate does the Senate. They are who they are. I don't know what all deals are going to be made and who's going to hold up what and what's going to go across the finish line. I know a lot of things are being said in the last 2 days of legislation, like it always has. We'll just see what gets around across the finish line. What I really do hope is I hope that the legislatures really look to see where we are in the state of Missouri and understand the economy we're in. We understand that we got a lot of people without jobs right now, and everything we can put in the toolbox to help build our economy back up and still have to deal with this virus, that we still got to be able to do that. Those should be the priorities really of this legislative session. A lot of good things out there. Like I said, reciprocity bill was a good thing, but that also creates jobs. It brings people in the workforce. So I think those are the kind of things that I think are priorities, but the Senate and the House have their different priorities too.
Do you support the prescription drug monitoring program the way it is right now?
Do not know what the finished product would look like. I'll give you the standard answer I always give until I see that bill on my desk to see what all's in it. I'm not going to commit to signing any bill until I see it, until I have my legal team and everybody go through that.
Hi, Governor. I know I asked you yesterday, but the legislature has been at work for a few more hours. A few more bills have passed. Do you have any general comments on the session? I know amid the coronavirus, but some of the work that they've been doing this week.
Yeah, you know what? I'll be honest with you. I'm surprised some of the things are getting done that are getting done. I think there's been some good things happening. They continue to be good things that help. So I appreciate the legislators coming in. I didn't know whether it's going to get much done. These are totally unusual circumstances. But I think anything they can do to help again with the coronavirus situation, whatever things we can do to help with that, things with the economy is good every day. I think the biggest challenge we all have and we still have going forward is the budget. I think the appropriations process, I think we still got a lot of work to do on that. I think there'll be more withholds coming up in this month before we ever get to July 1. And I think July 1, if the federal government don't do some backfill with the CARES Act, there's going to be, people need to be prepared that there's going to be a lot of things that's going to have to happen in the state of Missouri to balance the budget. And as governor, I've got to balance the budget, and I'm going to do it.
Non-session related, but as you are entering back out into the community, in the unfortunate circumstance that you may contract the virus, are there any contingency plans in place? Would that fall on Lieutenant Governor Mike Kehoe, or what would that look like?
Oh, yeah, there would be a time and place. We've had this discussion earlier on if something should happen to any man in a position when you're in a situation like we were, a virus, you never know. But, I've been around smart enough to know things can happen to anybody. You got to be prepared for that. So we had a place, we had an order in place. If something should happen to me, it would transfer over to the Lieutenant Governor, which is what the Constitution says. But we were prepared for that. I hope for me and my family, I hope we stay safe. But none of us is guaranteed tomorrow. I learned that a long time ago. So what I can tell you is work hard today, do the best you can, and, move forward. That's all we all can do.
One last question.
Obviously, this happened yesterday, and I assume you haven't made a decision, but the legislature did put a ballot initiative on the ballot involving redistricting. Have you any thoughts about whether you're going to place that during the August primary or the November general election?
I haven't, Jason. I haven't even looked at it yet. We still got that. We got the Medicaid expansion that we're going to have to make some decisions on, how we're going to handle both of those. And I think both of those things play an important role. I would say the Medicaid expansion part of it, we got to figure out something on that just because of the cost factor of it and where we are in the state of Missouri. So we kind of got to figure out when's the best time to do that we could really figure to move forward, because it's going to have an impact on the budget, and we all know that. So we just kind of got to get those things figured out. So those are decisions we'll be making. Probably, hopefully, in the next few weeks, we'll make those decisions so everybody will know. All right, thanks, everybody, for being here. Thanks.